Good morning, good afternoon, and good evening to all the participants in this webinar. I, I would like to present about filariasis presenting as a breast lump. This, this is a case report published in the Breast Journal in April 2021. I have nothing to disclose for this presentation. Lymphatic filariasis, commonly known as elephantiasis, is a neglected tropical disease. Infection occurs when filaria parasites are transmitted to humans through the mosquitoes. Infection is usually acquired in childhood, causing hidden damage to the lymphatic system. Myanmar is a lymphatic filariasis endemic region. The disease follows a chronic course and mainly affects the lymphatic or lower limbs, spermatic cord and epidermis, retroperitoneal lymphatics, etc. Breast is a rare site of the filarial lesion. A small number of cases were reported in the literature. Our case report is about a 47-year-old lady from a village in Pakokku, Myanmar. She noticed a painless lump in the left breast in January 2021. She was married and has 6 children, and all the children were breastfed. She has no nipple discharge. She has history of asthmatic attack 1 year ago. She has never taken filariasis, although she lives in MDA coverage area of Myanmar. On examination, there is a 4 into 2 into 2 centimeter lump in upper outer quadrant of left breast, which is a little bit hard. Axillary lymph nodes are not palpable. This is a complete black count of the patient. There is no eosinophilia in this black count. For every breast lump, we have to perform a triple assessment. But in this case, the patient resides in a rural village, and so there is no facility capable of performing mammography or aspiration cytology. So we decided to remove the lump in total. The excision of the lumps was carried out, and the excised specimen, one piece of tissue, contained mainly of fat tissue with small grayish white and firm area. The histological sections of the biopsy shows focal area of epithelioid granuloma replete with dense lymphocytes and eosinophils and some foreign body-type giant cells surrounding the central gravid filarial adult worm, containing numerous microfilaria of Bushria bancrofti. Adjacent regular adipose tissues and fibroadenosis were also noted. There was no evidence of malignancy. The histology is consistent with chronic granulomatous inflammation due to the microfilaria species left breast. This is the histology of the breast lump. The patient was treated with diethyl carbamazine (DEC) for 3 days. After completing the anti-microfilaria therapy, plasmia for microfilaria was checked at night times for 3 consecutive days, and it showed negative result for first 2 days and positive on third day. The patient was treated again with doxycycline. The plasmia for the microfilaria was repeated and found to be negative in all 3 specimens. Filarial breast lesions present with nodular firm hard mass often mimic neoplastic lesions in clinical examination. A few cases of filariasis in breast have been reported. When the female breast is involved, the larvae enter the lymphatic vessels, causing lymphangitis, fibrosis, and disruption of lymphatic drainage. Most common site is upper outer quadrant of the breast. Sometimes accompanying inflammatory changes in overlying skin, including edema of the skin, port range, and enlargement of the axillary lymph nodes, make it clinically indistinguishable from carcinoma. Ultrasound is a valuable tool in diagnosing cases of lymphatic filariasis and can demonstrate the adult wounds. A specific distinct continuous pattern of movement called the filarial dance has been described by ultrasoundologists. FNAC is a well-established, widely available, simple and effective means to evaluate neoplastic and non-neoplastic causes of breast lump. Cytomorphology of the breast filarial nodules show clusters of benign ducted epithelial cells, mixed inflammatory cells, and microfilarial worm. And although Myanmar is high lymphatic filariasis endemic country, filariasis of the breast is very rare. A high index of suspicion should be kept in mind if a patient from endemic area presents with a breast lump. We have to perform triple assessment in every breast lump cases to get the proper diagnosis. Thank you very much.